Okay, see how little that is?
Golly, it's teeny.
And so you can imagine a 6/0 is even littler, so usually it's a 5/0 that I use on the face. But again, 90 degrees, might do it on a littler wound, 90 degrees through, and these needles are a lot littler, so you might find that you need to do a double pass with these. Pull it through. Make sure you don't get caught up like that, okay? So double clockwise. See, and see how that just unpops, and it happens quite frequently, okay? So you sometimes need to do it and then do it again reasonably quickly. And pull it together on the second one, so it will come together on the second time you pull it together, okay? See how that just pulls that together? For the actual exam, we might make sure we've got 3/0 or 4/0. Right, so that's your basic interrupted suture, okay? So now, and another thing I find is when you go to do your next stitch, I always lock it into the artery forceps, because you'll find that you may lose it when you're going to do your next tie or your next suture. Right, so now we will go over the vertical mattress, okay? So these are a little bit more complicated. It's going to take a little bit of time to get used to doing them. But this is the one where you take the deep, so you go at about 1 centimetre, and this needs to be a double pass. And you go deep. So you want to do a really deep first one, okay? This is why we need bigger size. There we go. Because the reason we do these is because it helps get that deep tissue aligned better. You go through the opposite side and just make sure that you've, got them pretty accurate, okay, on both sides. Then what you do with this one is you have to reverse the needle, okay? And this is when I find I don't hold it normally. Now what I do is I just take it out, and it's easier to do this way, like that. Then you go on about 1/2 centimetre through, and this is a more superficial suture. So you can do one single pass if you find that that helps, or you can do a double pass. Again, it's in the same line, so it's vertical. Now with this one, what I was talking about before, see how on this, how it gets quite tight? So you've got to make sure that when they're talking about blood supply and necrosis, that it's really a stitch that you want to do. Because if you pull it, see if I pull it too tight, it just goes. And so you've just got to make sure that you don't pull it too tight. And when you tie, I'll show you what I mean about the wound edges averting. So see how you've still got that little bit of open wound? Now that's really common with this suture, okay? No matter what you do. And that's why you've got to, for your second stitch, get quite superficial and get quite, close to the top of the skin to help pull it together. But you will have that little bit of open. That's probably a little bit more than what you can have, but it will often stay open. So just be aware of that. But don't be worried about it, because it will still heal well with secondary intention if you're needing to do a suture like this. Chop. And then we've got our horizontal, which is the train. This is the one I like to use the best. I find this one's, apart from your basic interrupted, I find it works for me better than that. But there's different reasons that you'll use different sutures for. So this one again, this one you don't go as deep as the vertical, okay? Still deeper than an interrupted. You do need to double pass with these, the mattress sutures. And make sure when you're doing these as well with the mattress sutures that you're pulling through tight enough so that you're getting those deep sutures and they're pulling it together as you go through. Now with this one, this is the one that again you reverse. You can see these are quite fiddly. The one thing I do tell people is not to touch the needle with your hand because you're at a higher risk of needle stick injury. So with this one, you go in the same place that suture came in, and you go through. And again, you have to. You generally can't, depending on what size suture you got, you generally have to double pass. Okay. So go through both edges. And you get your train track. And back through that you're coming out about this, approximately the same width that you did with the first suture. See how that pulls that quite nicely together. That's why I like that suture better. I find it brings the top layers of the skin better together, and I find it's not as strangulating on the skin as that one. But when you have a go on the pig trotters, and they're real, or as real as we're going to get, they're a little bit, you can see, skin's a little bit, it's not as rubbery and as normal as this, and it's quite different, and every patient's different when you go and do it. So what I want you to do now